Hi, thanks for inviting me along today. My name's Helen McGlinchey from Northpoint Wellbeing. We're a charitable organisation, a third sector commission provider, providing mental health and emotional wellbeing supports to adults, children and young people across the Yorkshire region. Our three main services are our adult service and our Calderdale CAM service, where we're also a provider of the mental health support teams in that area, and also our school service. We're currently working in approximately 180 schools within that service, predominantly in Leeds, but also we provide support in York and Doncaster, and more recently in Harrogate also. So my role is Head of Service and Clinical Lead for the school service. I have senior operational responsibility and strategic responsibility for the school services in those areas. As a team, we're 50 therapists and practitioners, just to give you a sense of size of the team. And I'm also a clinical lead within the organisation, supporting the development of the clinical governance in terms of our therapeutic services, but also being that direct contact of support to managers and staff in terms of supporting clinical risk. So thought it'd be helpful just to be able to give you some background in terms of our work with children and young people. As I say, that's within our sort of Calderdale service and within our school-based service. It's a slightly different model in Leeds, and we've been providing therapeutic support in schools now for around 14 years. Just to give you a sense of sort of time scale to that. More recently, kind of within the last 2 years, again, sort of funding changed, and we were, as providers, we went through a procurement process with the Leeds Clinical Commissioning Group to become a preferred and approved provider to provide the support in schools as part of what is known as the Leeds Mind Mate Wellbeing contract. So the commission for us is 60% through the NHS and also 40% from the schools. In terms of Leeds clusters, what that means is geographical areas. There's 21 clusters within Leeds, and within each cluster sits a number of primary schools and secondary schools. And we're the main provider of that contract for 16 of those Leeds clusters. The model is very much short-term early intervention. That doesn't mean to say that the referrals aren't complex, but I guess that earliest offer of support as possible, is key to our service offer. In terms of the model itself, we're working with children from the age of 5 years up to 19. We offer sort of short-term 6 to 8 sessions, one-to-one face-to-face therapy, in addition to our sort of digital Silver Cloud platform support programs offers in terms of their young people's platform, which I'll be able to give you a little bit more background to as well. In addition to that, we offer group-based support and wider assessment and formulation where needed also. Through lockdown, I guess how we've adapted the model, we've been fortunate in that our schools have still allowed our sort of therapists to go in and deliver that face-to-face offer. Through lockdown, that was very much with vulnerable children and key workers children who were still attending school, but we recognised we needed to adapt quickly, so supported the team to be able to offer support through online platforms as well, in terms of Zoom or telephone sessions, if that was a preference of the young people. I'd say key learning for us in terms of our kind of work within schools, and as I say, that's been over sort of a 14-year period, is very much just working closely with the school staff, I guess recognising that they have the best overview of those children, young people and families. So key for us is those relationships. I think really having a clear model and framework, being really clear about the referral pathways. So for us, I guess that really reflects our sort of commissioning. So we have a route in terms of the CCG funded element through health as a single point of access referral route in Leeds, and referrals are triaged there, and if it's deemed that the most appropriate offer of support is within the clusters and the schools, the referral would come through to us that way. Or schools can refer in on behalf of that child or young person as well, and again they would be working really closely with the parents and families in terms of that, and they can hold, I guess, those kind of multi-agency referral meetings as well. So very much working in that multi-agency way, really being clear about the referral pathways, good communication with school staff as well. So we really link in with the pastoral leads, those designated safeguarding leads. Heads of year are really sort of key staff for us. And again, kind of really joining up as well. So when a piece of work comes to an end, I guess communicating back with school if it kind of feels that kind of support ongoing in school would be helpful. So for example, I guess discussing with a young person, then they might feel a sort of check-in with a pastoral lead on a weekly basis might be something that would be helpful going forwards, or any recommendations, I guess, of that nature. And in addition to that, again, if we feel we need to make an onward referral for special support, for example, into CAMHS, again, it's really clear in terms of that kind of referral route. It's all through, again, the single point of access MindMate service within Leeds, and we would support those referrals and again sort of join that up with school as well. So I think that is absolutely key. Safeguarding and risk again are obviously kind of really sort of key areas, and we've seen such an increase in terms of clinical risk and safeguarding concerns, I think, kind of through the pandemic, and obviously that continues. I think what's helped us with that again is using the patient management system, IAPTIS. So our sort of journey with that very much started for the school service through the procurement process. One of the fundamental elements of becoming a preferred provider was that you were able to use a patient management system that would flow and submit the data to the mental health services data set. We were already using IAPTIS successfully in Calderdale, so it made sense for us to be thinking about that for our Leeds schools work. We actually piloted it for the Leeds Clinical Commissioning Group a year prior to the contract starting. So again, we were very confident that it would be a successful patient management system for us going forwards when we were awarded the contract. I'd say it's been really significant for us in terms of, I guess, efficiency, in terms of as managers and service leads being able to oversee therapist caseloads, and again, I think absolutely key in terms of managing clinical risk and safeguarding due to the sort of the kind of risk rating systems that are available within the system. So again, you can see those at a glance. Of course, fundamental was that we could sort of successfully submit and flow data. Just to give you a bit of sense of scale, we usually have about 5,000 submissions within service per month. Got an excellent data lead in the team, which again I'd say would be a top tip. And kind of over the last months, we've had absolutely no rejections at all. Maiden have been very supportive with us in terms of those submissions, and again, kind of helping us through that process. And they were very much in terms of us developing our pathway, because within each service, obviously, that will be slightly different. And that again maybe needs a bit of tweaking as things go along. But again, I think that's one of the kind of really helpful things. You can really adapt and make that bespoke to the needs of your particular service. And that was a big shift for the team. We'd never used a system like that before. We were very old school, using sort of paper records prior to that. So it was a real transition. And but again, one that we've kind of done as a team, and in terms of where we've got to with it. And that localised reporting has been brilliant for the clusters. They often want those kind of bespoke reports, and because it's a live web-based system, we can be so much more accurate with that as well when we can submit those, and they pull off very impressive pie charts and all sorts of things that we weren't able to offer before. So I hope that's helpful, again, hearing about our journey in working schools, and thank you.